This is Mr. Coco. This morning we're looking at nursing care. So you'd find that maybe students may raise up some points. When they raise up some points in their nursing care, they would vote to give a rationale. So this morning I want just to look at, say, when you raise a point during your nursing care, what is the possible rationale that you can give? Because for every point that you raise, there should be a rationale. So let's look at now the eprophenema. So eprophenema, this is what students follow mostly when they are writing the nursing care in medicine. Okay, eprophenema. Okay, so when we look at that, meaning that's your nursing care. So let's look at the points that can possibly be raised generally, so that when you raise up in case that point, you can put a rationale. So let's look at, maybe if you were to say the aims of the nursing care, probably you would say the common one would be to promote quick recovery. So this would be maybe your aim there, quick recovery, and then maybe to reduce anxiety. These would be the common ones that you may have there. Then what about now in the environment? So in the environment, let's look at the points that you can raise in the environment. So in the environment, okay, let's see. So under environment, some nurses or some students would raise a point to say that I will nurse my patient near the nurse's bay. So if you're nursing a patient near the nurse's bay, what should be the possible rationale? So you nurse the patient near the nurse's bay because you want to easily observe them. So for easy observation. Okay, so easy observation. So this is observation. So you want to nurse them near the nurse's bay for easy observation. Then what about those who raise a point to say, I want to nurse my patient in a clean environment? What should be the rationale if you want to nurse a patient in a clean environment? This one is to prevent, you want to prevent nosocomial infections. Nosocomial infections. So that's what you want to prevent, nosocomial infections. Then what about those who say that in my environment, I will prepare the emergency tray. Okay, so if you prepare emergency tray, then what is your rationale for having an emergency tray in your environment? So rationale for having emergency tray is for resuscitation. You want to resuscitate the patient in case there is any danger that has arisen, or something that has come up that is maybe disturbing the patient. Then you need to stabilize them, so you need to prepare this emergency tray. When then others would say that I will prepare emergency equipment. Okay, emergency equipment in the environment, or just say equipment, maybe such as suction machine and drip stand. So these, they will be prepared. So you say I will prepare equipment such as a suction machine, drip stand in the environment for resuscitation, or to stabilize the patient, or you can say stabilize the patient, or for resuscitation. So it gives such rationales to say I will prepare equipment such as suction machine, drip stand in the environment to stabilize the patient or to resuscitate the patient. Then what about those who say that they will nurse a patient in a well-ventilated environment? Well-ventilated environment, what should be the rationale there? The rationale is to promote air circulation. So we want to promote air circulation. So these are the possible rationales that you can have with their points in under environment. So let's look at another one. You say, for example, you were to raise a point, say position. What about position? What can you write under position? For example, you say that I will position my patient in a Fowler's position. What should be the rationale for you to place a patient in Fowler's position? So the rationale would be this one: to prevent gastric regurgitation. Gastric regurgitation. Okay, so to prevent gastric regurgitation, that would be the possible rationale. Another rationale would be to promote chest expansion. Okay, that would be another possible rationale. Then some people would say after recovery, you would allow So after recovery, allow patient to just assume a comfortable position. You want them to assume a comfortable position because you want to promote independence. So this patient should be independent. That's why you want them to have or assume a comfortable position after recovery. Okay. So then, what about those who go maybe say to a point, say rest? When you talk about rest, let's look at what points you can raise plus possible rationales that you can have. So what about if you say I will restrict visitors? So when you restrict visitors, what should be the possible rationale? So I will restrict visitors in order for you to allow patient to sleep. Okay? So you want patient to sleep. That's why you want to restrict visitors. Or apart from the word sleep, you can use to allow the patient to rest. But you can say restrict visitors because I want the patient to sleep. Then what about if you say another one in terms of reassurance? Reassurance. So we're talking about reassurance in the sense that you want to encourage the patient to sleep. You want to encourage the patient here to sleep so that at least the body can recover from the stress that it is undergoing. So here you are going to emphasize the importance of sleep under reassurance, meaning the body organs will rest. That's why you want to reassure them that sleeping is very important because body organs will rest as well. Then what about the trolleys? What can you tell them about the trolleys? Witnesses may have trolleys which are not functioning properly. So we are going to say that you ensure that all the trolleys are oiled so that they do not produce a squeaky sound. So that that squeaky sound, you don't have it. No squeaky sound, okay? So you oil the trolleys so that there is no squeaky sound, so that the patient is allowed to sleep or rest. Then what about the TVs on the wards, the radio on the ward? What do you do with it? So you need to play them on low tone or low volume. So low volume with the TV and radio so that the patient can sleep or have enough rest. Okay. Then what about if you say procedures? So under procedures, so you're going to say that you're going to do procedures in blocks. All procedures will be done collectively or in blocks so that the patient can rest or sleep. So this is under rest. So you can come up with those points so that at least you have rationale as well. So it will depend on the condition, and you really have to know if you come up with a point, add a rationale. So those were just the possible points and rationales. What about now under observations? Under observation, what can you do? Under observation, you can observe the patient head to toe, but let's have just maybe a quick one, whereby say if you're observing capillary refill time. Okay, so this is capillary refill time, which is CRT. So you are observing this because you want to know or assess peripheral perfusion. So you're going to say that I'm assessing capillary, or I will assess capillary refill time to ascertain or to check peripheral perfusion because you're giving fluid, so you need to know if the patient is well perfused. Then you also be able to observe the tubings. Tubings are a lot. You can have drains, you can have IVF, or you are giving intravenous fluids, so you can have tubings. So you need to check for the flow or drainage. So you check the tubings. If it's the drains, you will check the tubings for the drains to assess whether they are draining or not. Then if you're assessing the tubings for the IV fluids, you need to assess to check if the fluid is flowing. So this one is flow. This one you want to assess if it's draining. For the drains, if it's draining. Then for the IVF, if there is flow. Okay, that's why you are observing those. Then you can also do TPR BP. Under TPR BP, these ones you need to get them for baseline. You are getting them for baseline, but then if the temperature is high, sometimes it may indicate an infection, or there can be damage to the hypothalamus, okay, or there's an infection. If the temperature is high, then you look at the pulse. Maybe if the pulse is high, sometimes you find that it's high because the patient has gone into hypovolemic shock. So you need to just check if there's hypovolemia or if it's compensating due to myocardial damage. So you need to do that. Then respirations, if maybe they are high, maybe it's a compensation, or the patient has a problem with the respiratory tract. So you need to just do that. Then the BP may be low. If it's low, you may suspect that the patient maybe has lost blood or they're gone into hypovolemic shock. So you just need to really know which one you're going to write there. Then under observation again, you're going to assess, if you're giving fluid, you're going to assess for fluid overload. Okay, you're going to assess for the fluid. So meaning, if you're assessing for the fluid, you're going to look at, you're going to check for the signs of fluid overload. You assess for the fluid intake, meaning you're going to look at now the fluid overload. So meaning I'm assessing for the fluid intake so that I check if there is any signs of fluid overload. Because fluid overload, the patient will have sudden dyspnea, so we need to just put that as a rationale. So you can really revise on this and really come up with points. Then sometimes if a patient has got maybe ascites, you can really go to abdominal gait, meaning you're going to get a tape measure and measure the abdomen. So this one is just trying to assess if ascites is subsiding. That's why you are measuring abdominal gait, or you're taking abdominal gait, because the patient has ascites. So you need to know if is the abdomen getting back to normal, or is the ascites subsiding. Then you can now look at many more under observation. So there's a patient, this patient can be observed from head to toe. You can check their weight. You can do a lot under observation. Then what about if you came up with psychological care? Under psychological care, what will you observe? So under psychological care, so some people would look at issues to say you assess mental state. Why would you assess mental state? Because you want to know if the patient is confused or disoriented. That's why you want to really assess mental state. So I am assessing mental state or status of the patient to assess whether, or to ascertain whether they're confused or disoriented. Then you'd now go to other things like in the nursing care, I will involve the pastor or the clergy. This one you're involving them because you want them to support the patient spiritually. So you're going to say that I will involve the pastor or the clergy for spiritual support. Okay, want the patient to be supported spiritually. Then what about when you allow family members? So say I will allow family members, so this is family members, to be involved in the care for love and care. So you're allowing them because you want them to continue for continuity of love and care to the patient. The patient should feel loved. That's why you're involving the family. So you are involving the family because the patient has to feel loved and care must continue from the family. Then what about when you say that you explain the equipment? So there is that word equipment there that you need to explain to the patient because the patient hasn't seen it before. So they'll be anxious. So you need to explain the equipment to the patient. You are explaining this because you want them not to have fears. So you want the patient not to have fear because of the equipment. Or you can simply say you want to allay anxiety. Then what about when you say that you want to answer questions truthfully? Answer questions truthfully. Okay? Why should you answer questions truthfully from the patient? So the rationale would be that you want to gain confidence. So you would say that I will answer all questions truthfully so that I gain confidence of the patient, because they'll be confident in you because you're able to answer questions truthfully. Then what about when you allow them to ask questions? So allow the patient to ask questions because you want to allay anxiety. Okay? That's why you want the patient to ask questions, because you want to allay anxiety. So you can come up with so many points under psychological care. So those are just a few that just giving examples so that at least for every point that you raise, you put a rationale. Then what about if you talk about hygiene? What about hygiene? What can you say about hygiene? So there are a lot of points under hygiene. So you are going to provide oral care to the patient to prevent complications of the mouth. So you want to prevent complications of the mouth, such as you're going to say halitosis, or maybe stomatitis. So these are the complications of the mouth that you're trying to prevent when you offer oral care. So you say, I will offer oral care to prevent complications of the mouth, such as halitosis or stomatitis. Then what about when you do daily bath to the patient? When you offer daily bath to the patient, depending on the condition, it can be bed bath, assisted bath. So depending on the condition, but when you offer daily bath, you're trying to promote body hygiene. So this one you're promoting body hygiene. So you want to promote body hygiene. That's why you want to offer daily bath. Then what about those patients, maybe say they are critically ill? You want to do 2-hourly tannings. 2-hourly tannings. So when you tan them 2-hourly, what are you trying to do there? You're trying to prevent pressure sore formation. So pressure sore formation. So I'm going to say that I'm tanning the patient, or I will tan the patient 2-hourly to prevent pressure sore formation. So meaning that's your rationale there. Then what about if you raise a point to say that you do pressure area care? Pressure area care. What is the rationale for you to do pressure area care? So I am doing pressure area care to promote blood circulation, because pressure sores are formed because of lack of blood. So promote blood circulation. That's why you are trying to do pressure area care. Or you can say to prevent, you're going to prevent pressure sore formation. Pressure sore formation. So that's what you're going to, that's why you're offering pressure area care. Then what other points can you raise here? Under hygiene. Under hygiene, you can raise another point, which is hand washing. So you can do hand washing. Why are you offering hand washing? Because you don't want the patient to have what we're calling cross infection. So you're trying to prevent cross infection. That's why you're doing hand washing. So the patient should wash hands before eating food and after using the toilet, because you don't want infection to be there to the patient. Even the nurse has to do the same. Before touching every patient, you wash hands, because you want to prevent cross infection. Then what about when we look at another point, which is exercises? What do you do under exercises? Okay. So under exercises, what will you do? Under exercises, you can offer passive exercises. Passive exercises, these will be offered because you want to promote or improve muscle tone. So we're going to improve muscle tone. Okay, because the patient who's sick, the muscles will atrophy or reduce in terms of the tone. So you need to promote or improve muscle tone. That's why you're doing passive exercises. Then those who are ill, again, you can do what we call chest exercises. Chest exercises. So you need to do chest exercises because you want to prevent hypostatic pneumonia. You want to prevent hypostatic pneumonia. That's why you're doing chest exercises to this patient. So now we can move on to nutrition. Let's look at nutrition. What can you do under nutrition? So under nutrition, depending with the condition, you can insert an NG tube. So when you insert an NG tube, you're trying to prevent starvation. You want to prevent starvation, because when you insert an NG tube, you'll be able to feed the patient through this tube. So you want to prevent starvation, because the patient shouldn't be starved. Then you also can give what we're calling TPN, which is total parenteral nutrition. Some would say transparenteral nutrition. So this is given IV. Okay, it's given IV. So this one, we're trying to improve the nutritional status of the patient. Okay, status of the patient. So trying to improve the nutritional status of the patient. That's why we're giving total parenteral nutrition. Then again, I can also go on to talk about the diet now. What kind of foods you can give. So proteins, you would give them because you want to replace or repair worn out tissues. You can give vitamins, foods rich in vitamins, because these foods, like fruits, they would boost the immune system. You know about carbohydrates, foods such as maybe nshima or porridge. These improve in terms of energy. So energy, the patient will have energy. Yeah, so you can give all that kind of foods. Then again, if you look at now, there are those conditions where you restrict salt intake, because you don't want water retention or to worsen the edema. So this one, you're trying to reduce edema, or you're trying to reduce hypertension. So that's what happens there. So those are the rationales that you can give. Then there are those conditions where you also now restrict water intake. So like in renal failure, you're going to restrict water intake. Okay, restrict water intake because you don't want to raise the blood pressure. Okay, because already there is water in the body, so when you give too much water, the meaning the blood pressure will rise. Then there are those conditions whereby somebody is being constipated and all that. So you're going to offer foods rich in roughage. When you offer food rich in roughage, you're trying to prevent constipation. So you're going to say that I will offer foods rich in roughage, maybe such as oats. Offer foods that are rich in roughage, such as oats, to prevent constipation. So that's what you're going to do. Then another heading that you can raise can be prevention of infection. So prevention of infection. Under prevention of infection, you are going to do catheter care, because this patient has been catheterized. So you're going to do catheter care. After catheterization of this patient, we are trying to prevent urinary tract infection. So urinary tract infections, that's what you're trying to prevent when you insert the catheter, when you're trying to do catheter care. Then what about when you try to do IV care? So I'm going to say I will do IV care because I do not want, I want to prevent direct direct entry of microorganisms into the bloodstream. So I want to prevent direct entry of microorganisms into the bloodstream. That's why I'm doing IV care. What about eye care? For those patients who are very sick, you're going to do eye care because you don't want, or you're trying to prevent corneal damage. Okay, so I would do eye care to prevent corneal damage for those who are critically ill, who cannot blink. Then hand washing, you're going to be hand washing before touching the patient because you want to prevent nosocomial infections. So you want to prevent nosocomial infections. Okay, that's why you are doing hand washing. Then you can go now to another heading, which is elimination. In case you came up with the point in terms of elimination, what can you do under elimination? So under elimination, you can look at a point such as catheterize. So you will catheterize the patient. So you're going to say that I will catheterize the patient because I do not want the patient to soil the linen. Okay, you don't want the patient to soil the linen. That will be one of the reasons why you are catheterizing. Another reason is to measure urine output. So I want to measure your urine output. So you can choose whichever one you want to write. I will catheterize the patient in order for me to measure urine output, or you catheterize the patient in order to prevent the patient to soil the linen. Then what about under recording? So I will record intake and output. To prevent, what are you trying to prevent here? You're trying to prevent circulatory overload or fluid overload. That's why you're measuring intake and output. And sometimes you can give less, so which is underload. So you can also prevent that because you have given less, so you need to balance the amount of fluids you can give. So under nursing care, you can have a lot of points. You can include a lot of points. You're not restricted to these. So these were just to give you maybe highlights on points in case you raise a point. What is the possible rationale that you can bring up? So thank you very much. We'll be posting another presentation. Okay, have a good day.